So in South Ayrshire we're taking a different approach to planning. We're looking at planning at a population level, so involving people right at the start who are either older, so looking at our older population, people with a learning disability or people with mental health and addictions problems. And also looking at locality planning, so looking down to different places and localities. And through involving people right at the start in generating ideas and then also holding us to account, so through those champions boards, through to the delivery of services. And we're hoping that through that we can move from a passive engagement of people in consulting them around a strategy through to a participation approach where people are contributing to both what the strategy looks like and also participating in delivering that strategy, but really moving through to a leadership approach where participants, communities and people who use services are delivering and driving and leading on the development and delivery of those strategies. And through that we're hoping to make some big changes in South Ayrshire.
As a planning performance team, we've really changed our perspective on how we engage and communicate with our communities here in South Ayrshire. We know that it's all about relationships and about building that trust and having that co-creation in order to allow us to work together to achieve better outcomes. And we know that ultimately this will empower our communities to start well, live well and age well.
In South Ayrshire, developing the strategy, what's been put in place is a champions board, which we were all encouraged to join after a meeting that VASA held in 2023, and I became the chair of that group. I'm convinced that it's really important that older people have a say in developing an ageing well strategy, because of course they are the people that are going to be ageing well within our community. So we're here to give people a voice, and it's been a very successful operation. We've got, I think it's more than 150 champions that are involved in that, and we hope the strategy will become an action plan and become successful.
So the League of Champions is a group made up with adults with a learning disability, they are carers and staff within the social work department to develop the adult with a learning disability strategy, where their voice was the core of the strategy. So they were able to tell us what barriers they faced within the social community, how they were feeling isolated after the COVID-19 pandemic, and what supports we had to offer and put in place to support adults with a learning disability to achieve their best life. So the League of Champions meet once a month, and what we do is we explore avenues within the community in South Ayrshire across the localities to see what opportunities we can provide. So the League of Champions approached myself and the social work team and said that they felt very isolated within South Ayrshire. There wasn't a lot of opportunities in South Ayrshire. So what the League of Champions created was the Community Hub. So the Community Hub is based in the town of Ayr in South Ayrshire, and it's also a drop-in centre as well, where we support adults who are looking for employment but they're unable to work, where we provide them with volunteering opportunities, training to gain employment, but also as well to create a safe space where people can drop in and they can go to groups and they can socialise together. So we're breaking down the barriers of isolation.
I think because of the management structure and the services that are aligned under that management structure, mental health services doesn't sit as it sometimes does in some areas in a silo. I think I'm able to kind of link in and reach out to the locality teams and locality managers and get support for their social work teams, their care at home teams, and kind of get that holistic wraparound care. I think is the biggest thing that we do well in South Ayrshire. In terms of kind of our links with mental health services, I think the other things that's kind of really useful and really invaluable for us is our kind of linkage through the sort of mental health teams themselves. They all sit under the same management structure. They all, and we've started a kind of corporate kind of governance structure that all mental health services attend a governance meeting together. So we're sharing collectively practice, we're looking at where are the transitions between the services and how do we manage those transitions better for the individuals, making sure that we're doing the utmost to kind of care for them at the crucial points in their care and treatment, because those transitions can be quite challenging for people. I think the last thing probably we do is that we do really well is just that kind of talking and listening to people and getting that sort of feedback. I think one of the crucial things for me is that the people that are receiving the service can quite often tell you what needs to change, how it needs to be improved, and I think that is something that we've been really fortunate over the last year, or I've been really fortunate over the last year, they've been able to experience in terms of actually talking to people on a day-to-day basis. And I don't mean just the kind of service users as well, because that's really valuable, but linking in with our third sector colleagues or voluntary services and making sure that their voice is heard as well, and making sure that their contribution to supporting individuals in South Ayrshire with different health needs is valued and valuable.
We make sure we take a good bit of time to meet with individuals, with families within our communities, to understand what matters to them, in terms of how we support them to manage their own health and well-being, and how we give them the right support and advice to go about that. Some of the things we'll do is we'll have a thing called the Locality Planning Partnership, and the Locality Planning Partnership is a group made up of people from the local area who bring their own lived experience, their community voice, and people who provide services within the local area. And we come together to discuss the priorities within that area and how we can start to support meeting some of those priorities going forward. That will involve a number of different things, where we'll look at data, some of the data from our colleagues in Public Health Scotland. It will tell us things such as life expectancy, long-term conditions, particular conditions or ailments that individuals might have within the local area, and allow us to start to use some of that data to inform how we go forward and provide support. Not only will we hear the lived experience about what matters to people, we'll hear about what works well. So we'll hear about the strengths within the local area, the community supports that people tap into, and it allows us as part of the workforce to think about how we continue to reinforce the community-led supports in the local area, but also actually signpost and support people to tap into those local supports as well. We run participatory budgeting events in our local area. The idea of participatory budgeting events, or PB events as we like to call them, is the idea of investing in our local community. So an opportunity for money to be invested in the local community around the areas that are important to them. How we go about that is we ask community groups to apply for the funding, and then we arrange for a PB event to take place where different community groups will come and talk about the community supports they provide, and local members of the community will come in and vote for a particular group that they'd like to see investment given to. The benefits of this is that it is very much about investing in the local area. It's about investing in community-led supports, and it's about community wealth as well as community investment in health and well-being. The benefits also of that are it's also an opportunity for members of the public to come in and actually meet some of the community groups that they might not know about. That whilst they may or may not get funding, they can still tap into those supports going forward, and it really helps to bring together that networking that's really important in local areas.
So, to help people age well, we have to be future focused and we have to plan for the future, which we're not very good at doing because we're always whack-a-moling the immediate chaos, aren't we? So today, what we'll be doing is getting people to think about what services we deliver, what new homes do we have to build, how do we allocate budgets effectively, and how do we also support the community and bring them with us when we're doing that. And we're doing that via a serious game, which is a board game, but it helps having something tangible and creative in front of you to think about in an innovative and creative space.
So from my perspective, it's a fantastic opportunity to get everybody in the room and start really thinking about what practically we can do that enables people to thrive into older age and make South Ayrshire a great place to live. So already getting started in the game, really enjoying thinking about what that means for individuals, the impact that housing has, the impact that services have, and the impact that budget decision making has. So it's all of those interdependencies. I think South Ayrshire is a great place where we're already working really well together, but this is really giving us a chance to really think through and rehearse some of those decisions that we make day in, day out. And often if we get those decisions wrong in the real world, obviously big consequences. Equally, if we get them right, that's what we're hoping to do today, run through those and start thinking about what will that mean in real life going forward.
Now, what we've recognised as a partnership is it's not always one size fits all in terms of how we provide support and care to individuals or communities. So what we try and do is we go out to engage with as many villages as possible, appreciating that what a particular person in a particular area might be looking for could be very different to someone else in another village. And it very much is how we work in partnership. As we work going forward, learning together and starting to put supports in place together, very much building on the wellbeing pledge we have in the Health and Social Care Partnership of co-production and doing things together.
So one of the challenges we face is that people can be sceptical that their voice will be heard or that it will lead to real change. So really what we want to do is encourage this open dialogue and ongoing two-way communication so that we build trust between us and the communities that we work for. And this really allows us to help to inform better services and to create better plans and strategies which more effectively meet the needs of our citizens.